I'm going to talk a little bit here about the process of hemostasis. And if you look at the actual meaning of the term hemostasis, it basically means stable blood. What this entire process ultimately is the process in which you basically stop bleeding. If you think about it, on an everyday average basis, there are very small microscopic vessels whose walls typically have a tendency to become broken or damaged. And blood should be ultimately within a blood vessel. And if those vessels' walls should break, well, then you're going to lose blood. And of course, your body doesn't want that to happen. So this process of hemostasis plays out in order to stop bleeding. It will allow the bleeding to be stopped and ultimately for the vessel to be repaired and healed. Now, you should keep in mind that this typically doesn't work for very large vessels. We're talking about microscopic vessels, things that we'll talk about later on, you'll see, but like capillaries and arterioles, very small vessels you can't see with the naked eye. But if we were discussing larger vessels like the brachial artery or a subclavian artery or something like that, this process wouldn't work. The vessels are simply too big and the blood flow too much in order for this process of hemostasis to play out. So hemostasis itself is broken up into three processes. They're not the three that you see on the screen, however, but I'm going to give you the three and try to describe to you each one. The image that you see on the screen here actually relates to the second process. So let's start out with the first process. That first process is called vascular spasm. And vascular spasm is what its name implies. It's a situation in which the blood vessel spasms or contracts. And that contraction of the blood vessel will narrow or decrease the size of its lumen. And when that lumen becomes more narrow, it will allow less blood to flow through that area. And consequently, when you allow less blood to flow through an area where the vessel is broken, you would have the potential for a lower amount of blood to be lost. It's just a simple matter of how much blood is there. So vascular spasm causes a vessel to constrict or contract, and when that occurs, the blood flow through the area will decrease, and that will allow the vessel, or rather, that will decrease the amount of potential blood loss. But you will still have an opening in that wall, a tear in that wall, and that's going to ultimately allow whatever blood is flowing through the area, at least some of it, will be lost. So in order to start the process of healing and repairing the wall, we first have to stop the bleeding, because as long as you have blood flowing out of that open break, you're going to basically not be able to fix the tissue, because whatever you would put there would be basically washed away. It's kind of like a dam. If it breaks or has a small tear in it, you have to sandbag it up first to prevent the fluid, the water, from coming out, and that will give you time to try and fix that crack or that tear, whatever the case may be. So the second step in hemostasis is called platelet plug formation, and that does relate to the diagram that you see up here. Platelet plug formation is subdivided into three processes itself. They are going to be platelet adhesion, platelet release reactions, and then platelet aggregation. So we're going to take a look and talk a little bit about what each one of these what each one of these steps involves. So let's take a look here first at platelet adhesion. Typically what happens when that vessel's wall becomes damaged, you're going to see some exposure of a type of fiber you've talked about before in probably AMP1 called collagen fibers. And these collagen fibers normally are not exposed to blood. If you look above here, you see the intact wall, and notice the collagen fibers are nowhere in contact with blood. But here in the bottom image where the vessel is broken, there are exposed collagen fibers. And what platelets in their surface, in the surface of their membrane rather, there are proteins that will cause them to stick to exposed collagen fibers, and this essentially is the first step of platelet plug formation, platelet adhesion. The exposed collagen fibers are going to allow the platelets to stick to the area where that vessel is damaged or broken. Now, once these platelets stick to that damaged area, they become active, and when those platelets are active, they're going to begin to release the chemicals, and now we begin to move into the second step of platelet plug formation, these platelet release reactions. In these platelet release reactions, the chemicals contained within the platelets begin to be released. You can see some of the chemicals. You don't have to memorize them for the purposes of your test. They include things like ADP, thromboxane A2, serotonin, platelet-derived growth factor, a bunch of other things, a few other things rather as well. And it sort of works like a positive feedback loop. As these platelets become active and they release their chemicals, those chemicals that they release typically attract other platelets to that area. And as more platelets are attracted to the area, those platelets also become active. They release their chemicals, and you get this chain reaction in which you have a few platelets activated, and then the few lead to more becoming activated, and overall you get a whole lot of platelets potentially activated. Now, the attraction that these platelets have and the activation of these platelets causes them to try and spread out. And as they spread, they begin to cover that broken area of the vessel. Ultimately, the collection of platelets becomes very loosely associated with one another in what we call platelet aggregation. The activated platelets now start to stick and adhere to one another and build essentially what is the name of this process overall, a platelet plug. So at the end of this, we have a platelet plug, and if you look, this is covering completely that damaged area. It will prevent blood from escaping out of that damaged area, and by preventing blood from escaping, you will have the opportunity to try and heal and repair that vessel, because you can't do more damage due to the bleeding that would still occur if you did not have that platelet plug. But the key here is that this aggregate, this platelet plug, is very loosely associated. If blood flow picks up a little bit, it may wash apart, it may fall apart, and we really don't want that to happen. So the next situation involves ultimately allowing for this platelet plug to become a more stabilized, a more stabilized structure. And in that situation, we ultimately have to allow that platelet plug to become what we call a clot. And that's the third step involved in hemostasis. And that third step is called blood coagulation or blood clotting. So let's take a look at that. This image will show you the overall pathway of blood clotting or coagulation. I'm not going to ask you to remember every little itty-bitty detail involved in this process. Your book will go into a number of different concepts related to it, but there's only a certain number of items that I'm asking you to remember, and that's what I'm going to address in this particular discussion. So let's first look at what starts or what initiates blood clotting. And if you look at the top of the screen, there's two potential triggers or two potential initiators for blood clotting / coagulation. We call them the extrinsic pathway and also the intrinsic pathway. The extrinsic pathway, as its name implies, is started by something that comes from outside of that blood vessel. If you look and follow the image here, usually this extrinsic pathway starts with some type of severe trauma, some type of severe damage to the wall of that vessel, and you can see the entire vessel is broken and there's an opening here. That opening would ultimately allow something from outside of the vessel to maybe enter that vessel, and that something is called tissue factor, and this tissue factor is the initiator for the extrinsic pathway, coming from outside of the vessel, hence the name extrinsic pathway. Once tissue factor leaks into that vessel, it sets in motion a very quick series of reactions. Now I want you to remember that this extrinsic pathway is fast. That's why I said it's a quick series of reactions. Essentially, you have some major damage to that vessel, so you need to try and stop the bleeding very quickly, and that's why this extrinsic pathway is fast. Several of the enzymes involved in this extrinsic pathway use calcium ions as a cofactor, so you see the calcium feeding into this process, and I want you to remember that as well. Calcium is absolutely necessary for this extrinsic pathway to play out. And finally, you should understand what the extrinsic pathway results in the formation of. At the end of the day, there's an enzyme made or produced as a result of this extrinsic pathway. It is called prothrombinase. So basically, I'm asking you to remember 4 big points. First, you need to remember what the initiator is of the extrinsic pathway. That is tissue factor. Second, you need to remember the speed. It's fast. Third, you got to remember that calcium is absolutely required. And fourth, you need to remember that it results in the formation of prothrombinase. Now let's take a look on the other side and talk about the intrinsic pathway. With the intrinsic pathway, it implies that something inside of the vessel causes or triggers this particular pathway. And that something is actually what we talked about and mentioned in the previous area where we talked about platelet plug formation. It's the collagen fibers. You see, the intrinsic pathway is usually triggered or set in motion by very slight, moderate damage to that wall. And that moderate damage usually exposes blood to collagen fibers. Once again, not usually seen there. Well, the exposed collagen fibers set in motion the intrinsic pathway. The intrinsic pathway, as far as timing is concerned, is also a little bit slower than the extrinsic pathway. It's slower because typically the damage is not as severe. And if we follow the pathway on down, we can also see that calcium is required for this pathway. So calcium is necessary for both the extrinsic and also the intrinsic pathways to occur. And finally, at the end of the intrinsic pathway, you're also going to end up with the formation of prothrombinase. So, kind of contrasting, I guess we'll say, what I asked you to keep in mind for the extrinsic pathway. I'm asking you to keep in mind 4 points for the intrinsic pathway as well. Number one, what is the initiator? In the case of the intrinsic pathway, it's exposed collagen fibers. Number two, the speed. You should remember it's slower by comparison to the extrinsic pathway. Number three, you should keep in mind that calcium is absolutely necessary for the intrinsic pathway to occur as well. And number four, you should keep in mind that it results in the formation of prothrombinase also. Now, if we go to the final step in blood clotting / coagulation, we'll see here that that final step or that final result is called the common pathway. The common pathway is called so because no matter what pathway you start with, the extrinsic or the intrinsic, the common pathway is the end result and everything from there on is the same. So we start with that enzyme we formed as a result of either the extrinsic or intrinsic pathway, and that enzyme is prothrombinase. When you see an enzyme ending in ASE, whatever's in front of it, it will break apart. So prothrombinase will break apart prothrombin to give you thrombin. So that's the first step in the common pathway. We have prothrombinase breaking apart prothrombin to give us thrombin. Notice, calcium is required here as well. So you need calcium in order for this step to proceed. In the second step of the common pathway, thrombin will convert a plasma protein called fibrinogen. Now, if you go back to our plasma protein discussion, we mentioned it there. It's about 7% of the total plasma proteins. But thrombin will convert fibrinogen into fibrin. And fibrin is an insoluble protein that will ultimately weave and wrap its way in between those loosely associated platelets in order to stabilize the clot. So it's the fibrin that will stabilize the clot for us. So to recap the common pathway here in its two major steps, you have prothrombinase converting prothrombin into thrombin, and then once we have thrombin, thrombin will convert fibrinogen into fibrin. Remember, both of these steps need the presence of calcium in order to proceed. Without calcium, neither step is going to proceed accurately. Now, because of the fact that clotting can obviously lead to occlusion or blocking of vessels, there is a need to try and tightly regulate where and how clots are formed. So your body has a number of different mechanisms that it typically uses to try and do that. For instance, simply blood flow, the movement of these various components, is a way to try and limit the interaction that they could have. And limiting the interaction will actually help prevent abnormal blood clotting. Dispersing these various components throughout blood. We could also talk about a variety of different anticoagulants as well. And just the fact that you have multiple steps involved is also a way in which the body tries to control clotting. There's a series of checks and balances essentially that have to play out. So there are various ways in which you will see that clotting cascade or this process of hemostasis control. Now, the next concept I want to mention to you, I actually don't have any slides to talk about, but I'll leave this one up. It's called clot retraction. And with clot retraction, essentially, that is the process by which this clot will start to become smaller. It starts to contract upon itself. But what ultimately is occurring is that the vessel is healing. As the vessel heals, it does so from the outer margins to the middle section of where the damage may occur. Consequently, as the outer margins heal, you don't need that clot there anymore, and the clot begins to retract as the area heals, and ultimately it will retract all the way to the point where it will basically break down and dissolve. Now, mentioning the fact that these clots dissolve, you should also keep in mind what allows them to dissolve. What happens is, as the clots are being built, typically the enzyme necessary to break the clot down is incorporated and trapped inside. That enzyme is called plasmin. Plasmin actually breaks apart fibrin, and when fibrin is gone, well, the clot becomes unstable and it basically begins to fall apart in an organized fashion. Now, plasmin comes from a precursor called plasminogen, and plasminogen is actually what's going to be trapped in the clot, and later on it's activated and becomes plasmin, and plasmin will be able to break down fibrin when the time comes for the clot to be dissolved. Now, I'm not going to go into all the clinical associations associated with clotting, because a lot of that is stuff that I'm not going to ask you questions about, but there are a series of anticoagulants like heparin, warfarin, Coumadin. These things that are also seen, you can read about it in the clinical association area of the chapter, the end of the chapter with the blue pages. The liver also plays a very vital role in blood clotting, because many of the plasma proteins involved, at least in blood clotting, come from the liver, like fibrinogen. So some of those anticoagulants interfere with the ability of the liver to produce various items or molecules involved in blood clotting. It's kind of an interesting discussion. But like I said, since I'm not asking you any questions about that, I'm not going to go into that in this discussion. And we'll pretty much end our discussion about blood clotting there.